Thanks for coming. I'm Alan Hollander. I'm the founder and CEO of ePractice Manager. Perhaps you've heard of ePractice Manager. Not going to talk much about myself, but really the story of what we do is a very, very simple one, which we've been doing for over 30 years. Running a business is stressful. For a dentist, unfortunately, is usually harder. What we do is we implement personnel and training systems that relieve the management burden from the doctor and allow the doctor to focus on patient care. We strongly believe that you want to be a doctor, not a manager. And the systems and tools that we've been implementing for decades with literally thousands of offices in the US and Canada solve that problem and address that issue. So what we're talking about today are tools that will do exactly that. That will make it easier and less stressful to operate the practice. Specifically, I want to talk about how the pandemic and the news that people are bombarded with is affecting your potential patient flow and your existing patient base. There are very, very interesting dynamics to this. I will tell you where the things that I'm talking about are implemented on a regular basis. We're seeing dramatic increases in practices. We feel, and we have felt this way from day one when COVID hit, that despite the serious issues associated with this pandemic, there are opportunities now that like never before for practices to survive way beyond any point that they have ever been surviving. And I'm going to talk about that going forward. Want to talk about why the consequences of not getting dental treatment now is so much higher. And it is. The consequences are far more serious. We'll talk about that. I recognize I'm talking to clinicians in most cases here. I'm gonna tell you things, and you know these things already, but your patients don't, and that's where the breakdown happens. So I'm going to talk about how to effectively communicate the consequences of not getting treated dental treatment now. These are things that every staff member needs to know. There needs to be a really uniform messaging coming from the practice. I will get into that. And I want to talk with you about how can you tailor and update the message that's coming out of your practice. What are you putting on your website? What are your people who are doing recall? What are your receptionists and scheduling people saying in response to questions that they're getting from your patients? This has to do with the message that you're delivering to the public. So that's what I'm going to go over. And let's start with this. Let's start with our climate. I don't mean the temperature out there. I'm talking about the climate, not even the economic climate, the mental climate. Patients are being bombarded by a bunch of talking heads. And they are, here's Dr. Doom talking about the rising virus cases in the US. I have a home in Florida. I'm there part of the year. I'm not there now, but when I talk to people about Florida, they're surprised that I'm still walking. And they have the idea from the media that, if you get off the plane in Tampa, you climb over bodies. Well, not really, no. Actually, the area I'm in, which is the Tampa Bay area, has a very relatively low level of outbreak, and has for a long time. South Florida has been impacted heavily. Not surprisingly, it's the most congested area in the state. But the media, and this is my point, the media has besieged the public with data that is scaring them and causing people to think primarily about their health. And here are the stats, and here are the typical headlines that we're seeing every single day and that your patients are seeing. And sadly, because people are staying at home a lot, what are they doing? They are watching television. And again, these messages day after day are causing people to be very, very concerned about their healthcare, their survival. And what do they want to know? What do people want to know? They want to know, if I were to get this disease, would I survive? Is my immune system strong enough? If I'm an older individual, let's say I'm somebody watching TV, I'm in my late 60s, I'm watching this, I'm hearing about how senior citizens can be impacted far worse than younger people, although evidently this may not be the case, we're finding out. But I'm looking at that, let us say, and thinking, oh my gosh, were I to get this, could I survive? That is not an untypical response, particularly when you walk around every day and we have these constant triggers. We see people with masks, we go into restaurants that are empty, and there's tremendous concern. The environment right now, we have a real culture of fear going on. But this is actually a major opportunity for dentists to impact the healthcare of individuals like never before. And of course, you know, the consequences of non-treatment are much, much higher. The communication, and again, forgive me if you know this already, the problem is this: your patients don't know it. Patients don't know the direct relationship between dental health and their and systemic disease. And I'm going to talk a little bit about that today. I'm not speaking as a clinician. I'm talking really more as a marketing person. I'm talking about how to get people to see the importance of opting in for treatment now more than ever. Why it is vitally important for them to be on those regular recall visits. And let's take a look at this. This is a, I'm gonna introduce somebody here. It's a 30-second video. Nathan Bryan is a world-renowned expert. He is speaking here. He's a scientist and researcher. He's talking here a number of years ago at Baylor University, Baylor College of Medicine. Dr. Bryan was on faculty and did research at the University of Texas for many years. And let's hear what he has to say. I think you'll find this very interesting.
Good morning. It's truly an honor to be here and to speak before you today. So my objectives are really clear. And so over the next hour, I'm going to be telling you really spending 15 years in basic science research and trying to condense that down into about a 50-minute talk. But really my objectives are to convince you as dentists that you're probably the most important people for treating chronic disease. We've got a number of sick people walking around, and until you clean up oral infections and get these toxins out of patients, there's no way they can get better.
Well, there's the message. He's there. He's speaking to clearly to a group of dentists, and he feels that he has to convince them of this particular point, that they are the most important people for treating chronic diseases, and he states briefly why. By the way, any of the material that I'm covering today, you will see at the end the where this material is from, and we will have a link that you can go to where you can download his YouTube video, his entire talk, which I encourage you to watch, and other material that I'll be going over. But this is the message that has to be communicated to patients. So let's look a little bit further here. This is something. This is excerpted from Mayo Clinic's study on the relationship of dentistry and oral health. Your oral health is more important than you might realize. Contributes to various diseases and conditions. Again, you may know this: endocarditis, cardiovascular disease, pregnancy and birth complications, pneumonia, the bacteria in the mouth that goes into the lungs and causes respiratory disease. There's all kinds of science on diabetics as well, the effect on poor dental hygiene and diabetes, cause and effect relationship there. This data is irrefutable. These are the consequences of neglecting dental care. The patient who, and very important, I want to make this point immediately. Every single employee, every staff member in a practice needs to understand this message. Yes, making a smile beautiful is a great thing to do. We know how people are happier when their smile looks good, when they're not afraid to smile, when they have all of their teeth, they're nice and white, they have less attention on themselves, makes people more comfortable. Not to mention the fact that people understand the obvious benefits of oral health and proper hygiene. But when it comes to making decisions on elective procedures, those, by the way, that might be rather expensive, for an individual to make a decision like that, they have to go through a certain process of evaluation that really, where they see the consequences of not doing that, not opting in for treatment, are actually worse than the discomfort associated with having to pay for treatment that they didn't even expect. So we'll talk about some specifics on this. This is an article. This is from a publication called the Journal of Aging Research. This was a study published in 2011. It was done over a period of about 17 years. It is not just this is not a little, this is a very in-depth and comprehensive study. It was done also on thousands of individuals. I believe the number is just over 5,600 people. This is why people need to get their dental treatment. This is the reason why, and this is what they need to know when they're a little bit iffy on moving forward on their treatment. Let's just go through a little excerpt here on risk. Now, we're not talking about risk of getting a cavity, okay? We're not talking about the risk of perhaps having a smile that doesn't look as nice as we'd like it to be. We are talking about another risk here. Toothbrushing at night before bed, using dental floss every day, and visiting the dentist were significant risk factors for longevity. Longevity. You know, the old Crest commercials, you know, and the things that we've seen on TV about the importance of brushing every day and having healthier teeth. Well, of course, we know that. But that is just the surface reason why we're talking about longevity here. Never brushing at night increased risk 20 to 35% compared with brushing every day. Once again, forgive me for sounding a little bit repetitious here, but the risk, that 20 to 35% risk we're talking about, is risk related to mortality and longevity. Never flossing increased risk 30% compared with flossing every day. Not seeing a dentist within the last 12 months increased risk 30 to 50% compared with seeing a dentist 2 or more times. These are the reasons individuals need to comply with treatment and accept treatment and schedule right away. Why? Because mortality also increased with the increasing number of missing teeth. Edentulous individuals had a 30% higher risk of death compared with those with 20 plus teeth. All right, so is this an effort to scare people into accepting treatment? You know, that would be the most cynical individual's explanation of what this is. We have a public out there right now. We have patients out there. Well, they're afraid to come in. They're scared. Many people are. Why are they scared? Because the constant bombardment of scary information coming from the media is causing them to think about what? Their mortality. That's what they're thinking about. Will I live through this? Will my parents live through it? What about my children? You know, my family. The issues now have to do with longevity. People are more concerned about their well-being and their health than they ever have been before. But there is a disconnect. There is a disconnect, a lack of association that patients have in general between their dental health and their longevity. The effect that poor dental care or neglected dental care has to do on inflammation in the body. And the effect on what system? What major system, which determines our ability to withstand disease? Our immune system. These are cause and effect relationships. The studies on these there are volumes on it. And again, I'm delighted to share this with you. So, again, I'm not preaching, I may be preaching to the choir here. Yes, you know this, but do your patients know this? Has the hygienist, when that patient comes in who's supposed to be in on recall for every 4 to 6 months and comes in every 2 to 3 years, does that individual really understand what they're doing in terms of their overall health? That individual who is a dentulous has extremely uncomfortable dentures and has been thinking about replacing them with implants, getting a whole arch or two. Yes, it's very, very expensive. Fascinating point in this study is that the difference between individuals who have no teeth and those who have a full mouth in terms of longevity is over 7 years. And of course, a discussion on the relationship of mortality to the number of missing teeth is, I feel like it's a responsibility of either the provider or the treatment coordinator or the hygienist or whomever in the practice to have this discussion with the patient. And I have this study, again, you can go to our site, you can download this. This is worth reading. For our clients around the country, we make it basic not the entire article because it just gets into issues that aren't necessary to read, but there are parts of this that every single employee in a practice, it doesn't matter if they're a clinical person, needs to understand so they can get this message. Here's another article. This is from How Oral Health Affects the Rest of You. It's from Men's Journal. It's not a scientific piece, but it quotes some wonderful, wonderful studies. And just a few excerpts here. Patients with periodontal disease were 30% more likely to suffer a first heart attack than patients with a clean bill of health. An individual, we have an individual, let us say, sitting in front of us in a practice. Let's just say they have a history in their family of heart disease. Let's say they've had some symptoms, some coronary related symptoms. An individual who has that going on needs to be told in no uncertain terms. You know, they need a little tough love, and they need to know that they're increasing the likelihood of a heart attack, particularly given what looks like a predisposition anyway. They need to understand and be told that what are the stats on this? Here's what you're risking. This data on coronary bypasses and the clogged arteries that had oral bacteria in it, again, we've seen this study has been out for a long time. And anybody, again, who's had any history of heart disease or heart problems, to opt out of dental care of any type is not an intelligent thing to do. And how do you increase intelligence? You educate an individual. People don't buy what they need. They don't. You can say to somebody, you need this. The individual has to have some emotional connection with it to determine that they truly want it. And that's why this has to be done. They have to make that connection. They have to get to a point where they want it. That's emotional. Want, desire is emotional. Need is quite rational. Yes, I mean, you've seen individuals to whom you've presented treatment, you've discussed the importance of it, spelled it out, it's quite rational, but they don't get it. That's why if they don't really look at the consequences, the real consequences and of what opting out of treatment can be, that's unfair to that patient. I don't think we're trying to scare people at all. I think we're just trying to wake them up. This isn't about higher production in a practice, although it will result in that. We've proven that hundreds of times. But it's about the ownership of the view that Dr. Nathan Bryan pointed out in the beginning here. I hope you'll watch that YouTube video. It's really very, very enlightening. Again, I think it's something that everybody in a practice should see. No, it's not about that. It's about improving people's lives. It's the impact of the dentist on that patient and that patient's family and their longevity and their happiness. The data on diabetes, the relationship between oral health and diabetes, again, very, very clear. Again, I'll be delighted to send you this article. It's just, it's really terrific article with lots of little points here. We use these we make these articles, by the way, part of job descriptions for dental staff. It's just basic information about the practice and what are we doing? What are we doing here? Why are we really here? This is why. This is why. And now more than ever, this resonates. This is going to resonate with your patient base. Marketing to be effective. Marketing to be effective has to be real. You drive by a billboard and you see something and you kind of scratch your head and you turn to your wife and you go, isn't that ridiculous? What does that have to do with anything? Or you watch a commercial and you just sit there and, there's a big question mark as to who are they speaking to? Well, obviously not to you. But this message that I'm talking about on the real consequences of lack of dental care and an individual's overall health and the strength of their immune system, that's the message. And that message will resonate now because people are concerned very much about their health. I'm just, earlier yesterday, I was on the phone with an individual who has a business that does home exercise equipment. And they were commenting how their business has just gone through the roof. It's an online business that sells home exercise equipment. Very simple, very inexpensive stuff. They can't get from their suppliers enough of it to fulfill what individuals want right now. Why? Because it's not just that people are home and bored. They very well may be, but they know, because this message is getting out, thankfully, that individuals, that one of the most important things that we can do is exercise. And so, of course, home health systems, home exercise systems are growing. This is the mentality. Our culture, our planet is thinking about this. So this isn't a scare tactic. This is talking about these are the consequences. Various progression of heart disease and diabetes and the chronic inflammation that is a fact that is at the source of many diseases that people have, the weakened immune systems. Yes, of course, we know missing teeth can exacerbate and increase bone loss, facial structure, overall structure, absolutely. But most importantly, we're talking about longevity and the long-term systemic effects. Yes, here is our doctor who is the new hero in town. He or she really assuming the role and the identity that the dentist and the dental practice can be responsible for maintaining the overall health and well-being of patients, of the community, is a fact. It's a fact. Again, I refer to Dr. Bryan's statement that an individual's health is not going to improve stably and substantially until the dental issues and bacteria in the mouth and the toxic effects of that are dealt with. That's not conjecture. It isn't speculation. It's not a theory. So again, okay, you know this, but do patients know this? No, they don't know it. They don't know it. So this is the messaging that needs to go to your patient base on a regular basis. The consultations that you may be doing with patients need to take a look at their health and their overall well-being. And this needs to be included in the dialogue. We train practices everywhere on how to get higher case acceptance. And frankly, now it's not as hard because people really, when they take a look at the direct relationship of their dental health to their overall well-being, their immune system, they are far more likely to opt in. We are seeing, I mentioned this as a fact, we are seeing practices where they're implementing these procedures intelligently into their offices, where they're training their staff on these things, just having people read the material. Heavens, it's just so simple. and raising the awareness of it, talking to the staff about, wow, look, why are we really here? What are we trying to accomplish? What can we do? Look what's going on around us, and what they as individuals can do really is quite inspirational, and it's a new message for most practices. If this is what you've been doing, if this has been your viewpoint for many years, wonderful. But I dealing with practices all day long for decades now, this is not necessarily the viewpoint that is expounded. So this is the message, the consultations and practice messaging, whether it's on your website, whether it's in your social media, just a lot of practices. We did dozens of webinars throughout COVID, and we were pushing very, very heavily to ensure that on the website it stated very, very clearly that how you were exceeding the guidelines, the CDC guidelines, and your state guidelines as well as any others. The truth is, your patients probably can't come to a safer place as far as infection control is concerned, but patients need to know that. But they also need to know, once they get there and they're sitting down and they're doing a consultation or they're getting that exam on recall, they need to understand the relationship of their dental health and their long-term health, and how important it is now. Because they're going to be reminded of it the moment they walk out the door and turn on the radio or go home and watch the news. Again, social media can push these messages out in so many different ways. So those are my key points. I know I've pounded on it, so forgive me, but we're very passionate. We're very passionate about it. We're excited about this because we're seeing immediate increases in patients accepting treatment, and in some cases much larger and more extensive treatment plans than clients ever thought that particular patient would opt in for. But they are opting in more. So now more than ever, you must actively communicate the consequences of non-treatment and how this affects overall health. Staff, when everybody in the office, the scheduling person, the person who answers the phone, the individual who's doing recall, scheduling insurance, you name it, back office, certainly chairside assistants, when they understand and have this uniform message that is given to the public, tremendous impact on the practice. And I invite you to review your website and social media and emphasize this messaging. Okay. All right, good. Here's what you can do. If this is resonating with you, I hope it is. Go to our site. Go to ePracticeManager.com/CRP. We have that's our COVID recovery program. You can use our little online calendar and schedule a free consultation. What we'll do is we'll take these principles, we won't charge you anything, and we'll show you how you can implement these in your practice. It's strictly to get this message out so we can help change, maybe affect a paradigm shift here, and help practices get back to where they were pre-COVID and beyond. We're seeing a lot of that happening. And 3, start relieving your management burden right away, because when you see this happening and you see staff performing in this manner, this is one piece of that management burden that won't be there. We feel that doctors need to focus on patients, not management. And all too often, even practices that are doing extremely well, sometimes when those numbers go up, those cause even greater stress and frustration. The demand is higher. And it doesn't have to be that way. It does not have to be that way. It can change. It can change dramatically. You can, if you, as I said, if you'd like to schedule a free consultation, just go onto our website. If you want to just access the resources, the material that we have here, go to ePracticeManager.com/get-resources. And you can download any of the documents that I've referred to, and any of the links and so forth. All that information will be there. So you can do that. You can do that as well if you prefer. If you prefer to do that, okay. You know, we want doctors to do the things that they love with the people they love. That's what we want. And you know, we want our clients, and we want to see the dental community able to reap the benefits of having a great practice and a great, but leading to a great life, and enjoying vacation time and being able to do it without being stressed, you know, with your lovely spouse or partner and or your kid or your kids. I mean, really, that's really what we want. And so again, you should be able to focus on patient care, what you have been trained to do best, and not be belabored or burdened with management or personnel related issues. So as I said, go to let me give you that link once again here. You can go to this link, ePracticeManager.com/CRP. You can schedule a free consultation. You'll get a great deal from it, and you'll start relieving your management burden right away. And the other alternative, of course, is get the resources from us. Just go to our site, get resources, and download the information. All right, let me see if there are any questions here. Give me a moment. Maybe we can all learn something from these chat. Let's see. I see a link. Whoops. No, I don't.
Hey,
Okay.
Alan, I have one here for you.
Oh, okay, good.
What is the best method to train employees on how to communicate this message to patients?
Yeah, good question. Yeah, the best thing to do, I would download the two articles that I referenced, and I would read through them, excerpt what is most relevant with that you see is relevant with your patient base. And I would actually have staff practice talking about those things with patients. Get into a staff meeting, do role playing on it. You know, sometimes people, they do have a little bit of a concern about, oh my gosh, I'm kind of scaring the person. Well, that's not your intention. If the person gets a little bit nervous and scared, maybe that's a good thing if it motivates them to do treatment that they really need to do to improve their health. So that's what I would do, Sarah. I would do that. And again, as I said, if you want a consultation on this with more detail, it's free, and we're delighted to spend the time with you and offer advice on how you can implement this in your practice.
Great. And then also you mentioned the social media being updated. Is there any other places that we could update this message?
Well, yeah, of course. I mean, I think the practice's website needs to have materials that talk about that talk about this. There's no lack of this material. You just Google dental care and overall health. You Google that. You Google dental care or dental health and systemic disease, you'll find all manner of studies and material. I would excerpt those things and put them and feature them on a website. I would send these out in social media. I would be sending pieces of information out to my patient base on Instagram, Twitter, Facebook, and you name it. You can't promote this too much.
Awesome. Thank you.
You're very welcome. All right. Any other questions? Okay. Thank you all. Thank you all very much for coming. Go to our website and schedule a consultation. If you don't feel like you want to do that, certainly take advantage. Go to our site, ePracticeManager.com, get resources and download the material. And I wish you all the very best. By the way, we're going to do another webinar with Dr. Bryan coming up, the gentleman who I showed in one of the earlier slides. So we'll keep you posted on that. Thank you so much. Bye, everybody.